When I say to people, what's your biggest challenge, they always say it's not having enough nurses. As part of the round table today, what we'll be talking about will be the recruitment and retention challenges. There are directors of nursing and HR directors and directors of workforce and people who are in charge of training, and they're really interested in finding out what people are doing to try and manage the care that they're providing.
Recruitment retention is really important because we have to ensure that we have the right people with the right skills, the right talents to be able to give the best possible care that we can.
What are we going to do to try and develop and retain the new nurses that are graduating?
Learning and development is really crucial for nurses. You want to keep the really good nurses, and the really good nurses are really interested in developing themselves and being a better nurse. So I'm really keen today to speak to some of these people who are struggling and surviving with that challenge and finding out just what they're doing.
One of the reasons people exit is because they didn't get flexibility. But I'm not sure going to the next trust gives them any more flexibility. Wherever you go, nurses are talking about how we can retain better, how we can recruit, and new ways of working.
Funding has been cut, and so we've got to think about new ways of looking at education, developing our staff, think about innovative ways to help to retain our staff and ensure that our patients get the best care they can.
Every opportunity to talk to people, share ideas, and think about new ways of working is something I want to take up.
Just having colleagues from different sectors, different perspectives, different geographies, everybody brings a different perspective to the discussion that you don't necessarily get in bigger meetings.
It's great to mix with other people, hear their ideas, and realise that other people have got the same challenges as we have.
In these times when it's so difficult to recruit and then retain nurses, when nurses have so many options about where they can work, it's really good to have something like Nursing Times Learning, which sets you apart and says, I care about nurses, I care about your development, and I care about keeping our patients safe.
I'm pleased to feel there's still new ideas out there.
It's an incentive for nurses to stay within their roles, knowing that they've got something to help them with their CPD and their development.
It's about taking fantastic content that's been peer-reviewed, that you can trust, that has a real evidence base, and saying you can use this to improve and inform your practice. It's keeping nurses skilled, but it's keeping patients safer, and I think that, who wouldn't be passionate about that? That's amazing.